I'm Ernie Manous, and this is Town Square. We pivot now to imposter syndrome. This feeling of doubting your abilities and feelings like you're a fraud, despite your hard work and accomplishments. Do you have these thoughts and feelings? What can you do about them? Our phone lines are open for your questions, comments, and personal stories and experiences. 888-486-9677. That's 888-4-TOWN SQUARE. You can also interact with us and follow us on Twitter using @Town Square Talk. Joining me right now is an expert on imposter syndrome. It's Dr. Gazelle, assistant professor of medicine at Harvard Medical School and a master certified coach for physicians and physician leaders. Dr. Gazelle and her work have been featured nationally on such networks as CNN, CBS, NBC, Fox, NPR, and the New England Journal of Medicine, and even Oprah's magazine. Welcome to the program, Dr. Gazelle.
Thank you so much for having me.
It is great to have you with us. I started on this topic thinking, okay, imposter syndrome. And then I started getting deeper into it and realizing just how many people it impacts. But before we get into all of that, let you set it up and what we're exactly talking about.
Well, let's call this the imposter phenomenon rather than imposter syndrome, because it really isn't a medical type of illness or syndrome. And it's this idea that what we know is tiny, really so much less than our peers and other similarly situated individuals, and that somehow what they know is massive. And then in that disconnect, we feel like we're a fraud, of course, and that it's only a matter of time until we'll be found out and we'll be kind of declared the laughing stock of our institution or our community. So it's a source of a lot of anxiety for many otherwise very high-functioning individuals. I'm not surprised that your lines are already busy with callers who want to discuss this topic.
Well, before I get to them, too, I do want to check that when we talk about this, I think a lot of people think, yeah, I've experienced that, but nobody else does, which is part of the problem of the imposter phenomenon to begin with. And what has your studies shown in how many people, what percentage do you think, if we can even gauge it, actually experience this at some point in their lives?
It's such a good question, but I think we have to own the fact that we don't really know. Nobody walks around feeling like an imposter 24/7. It's often in moments of our day, if we're leading a meeting, for example, giving a presentation, speaking to a group of some sort, or in a moment of evaluation, a performance review, or at the time that we're maybe looking at a promotion. So we might even think about imposter moments rather than something pervasive. And studies vary, from as low as 20% to as high as 90%. So I think it's one of those phenomena that's a little hard to measure, a little hard to pin down.
Mm-hmm. I also think when people think about it, once again, you think it's just you. But when you study it and you look into it, folks like Maya Angelou have felt it. Albert Einstein suffered from it, or experienced it, I should say. I remember doing an interview years ago with PBS NewsHour's Jim Lehrer, and he told me how occasionally he would wake up in the middle of the night and think to himself, I can't do this job. I don't have the background. I'm a fraud. And I was shocked in the time, never having heard of this imposter phenomenon back then, but he was expressing exactly that.
It's really fascinating, isn't it, that I'll say we, because I've certainly suffered from it, we can walk around thinking it's just us. And as you know, that's part of the problem. And yet all you have to do is hit a few keystrokes on Google and you'll see an amazing array of people. Some of the ones that you mentioned, but Tom Hanks, there were recently some quotes from Helen Mirren, so plenty of people, in the acting business. But as you say, Albert Einstein, Sonia Sotomayor, Maya Angelou, Michelle Obama. It's amazing how many very high-powered, high-accomplished people that we would never suspect of doubting themselves actually live with this fear of somehow being found out.
Okay, let me turn this on its side a little bit here and ask this. Could the phenomenon of imposterism, whatever we're going to call it here, could that actually propel you to do more? We talk about all of these very successful people who have experienced it. Could it play in them becoming more successful?
Well, again, one can imagine how that would occur. In other words, if you're walking around afraid that you're going to be discovered as a fraud, It can lead you to go through all kinds of contortions to do things perfectly, and I put perfectly in quotes. And then when you succeed and you maybe master a topic or give a good talk, whatever it is, then you get into this cycle where you believe that all that anxiety, all that staying up late and dotting all the I's and crossing all the T's was actually the reason that you were successful. So you develop almost a type of superstition about this. And it's a dangerous cycle because, as we know, perfectionism by definition is an unattainable standard, and yet it becomes part of the fuel for this somewhat distorted cycle that many individuals can find themselves living in.
Let me take a moment here to remind everyone I'm Ernie Manous. This is Town Square. We're talking with Dr. Gail Gazelle of the Harvard Medical School. Our phone lines are open for you to share your stories with us about imposter phenomenon and other areas that bring you great worry and concern about your own personal success. Our phone number is 888-486-9677. That's 888-4-TOWN SQUARE. Let's go to the phones and start with Julie. Julie, what's on your mind today?
A couple of things. For one thing, you mentioned something about not medical. I think so. Ever heard of heartache? An imposter also is could be a put down. When I talk to a certain person, show her something. It made nose too big. Someone gives me a plate, gives me the plate, and this person says later, "We can get rid of it." Am I an imposter by accepting things that someone else doesn't like?
Julie, thank you for your call.
Scary.
It's some area of conversation here, Dr. Gazelle. I guess imposter phenomenon comes in many different ways, and that's what I'm taking from Julie's comments.
It can come in all sorts of ways, and I think what I'm hearing a little bit in Julie's message is that we feel like we don't deserve the good things that happen. We think it's luck, chance, maybe just knowing the right people, being in the right place at the right time, anything other than our own skills, talents, native abilities, and strengths. We really downplay that we have any of those things. So when somebody perhaps gives us an opportunity, let's say, to move up and be promoted in our workplace, we can be mistrustful of that. We can think, well, they don't, maybe they're just feeling sorry for me because it isn't because I really have all of these skills and strengths that would lead me to be promoted. So it's a bit of a delicate balance, this focus not on our strengths, but on our fears and worries and anxieties about ways that we're coming up short. And it leaves us really selling ourselves short, not showing up in the fullness of who we are, not bringing all of our gifts and talents to our workplace and our communities, afraid of taking risks, fearful of putting out new ideas, and really depleting ourselves because it gives us less energy to focus on all the good that we are doing and even more good that we could be bringing to those around us.
I may just be playing wordplay here, and if I am, correct me there, but I kind of was taking also from what Julie said is that she may feel phony. Like if somebody gives her a gift and she thanks them and how much she appreciates it, but she knows she's going to get rid of it later, that she's being phony, the person. Is that in the same realm of this, or is it something different?
I think that's something different. We all can get gifts where they're not quite the right fit for us. I think we've both been on the receiving and giving end of that, all of us. So I hear something a little bit different there. I think that's just sort of a foible of social interchange in a society where we do give gifts as part of kind of our cultural milieu. I don't really believe that that's the imposter phenomenon that we're talking about here, where we're doubting ourselves, we're doubting our abilities, our strengths, our capacities, and feeling like we're somehow coming up short. I think that's a bit different.
Let me remind everyone, our phone number is 888-486-9677. That's 888-4-TOWN SQUARE. Elizabeth, you're up next. What's on your mind today?
Yes, thank you so much. I have coped with feeling like a fraud since being a teenager. I landed my first management position at 18. It was a situational, I was the person that was there. I landed my first executive position when I was 19. And I continued to have what I saw as these amazing professional positions just fall into my lap with no merit of my own whatsoever over and over and over again until I got to the point where I'm managing multi-million-dollar accounts and really the entire time feeling like I am role-playing someone of this professional capacity. It can't possibly be that I know I'm really consider myself strangely only minimally educated and fairly unskilled. And so I feel kind of like an imposter, that it's not really on my own merits, that it must just be this perception of me is this reason why I have had this professional career as opposed to something that's actually to do with my abilities.
Yeah, I'm going to pass you to Dr. Gazelle in just a moment, but I do want to ask, was there a point where you heard imposter syndrome or the concept of it and it started to ring true with you, or have you gone this time without really realizing that?
Never until today have I heard that this was
really
something that other people also experienced to the point to where there's a name for it. I really just thought it was me.
Let's have you talk to Dr. Gazelle. And Dr. Gazelle, your thoughts?
I'm so glad that you called in, because I think that all of your listeners, and certainly me, can hear the anguish that the imposter phenomenon creates, whether we have a name for it or not. What you're talking about all these wonderful promotions that you got, clearly somebody was seeing your skills and talents and not just doing this to feel sorry for you, right? So it causes so much anguish, and yet it's individuals like yourself who experience this phenomenon. Sometimes it occurs because we're branded as smart for individuals who are high achievers academically, let's say in grade school and high school and college. Those individuals can then become fearful. Well, what if I don't do well on the next test? What if I don't get an A+ in the next course? What's going to happen? But at the same time, at the other end of the spectrum, if you're not somebody who, excelled academically, for example, or went on to college and professional school beyond that, you can suffer from feeling like an imposter, because then you can start feeling, well, do I belong? Do I have the smarts, the training, et cetera, that some of my peers have? So it's really interesting. I see the imposter phenomenon as kind of a trick that our mind plays on us, a little bit of the pull to the negative, the negativity bias. And we're going to talk a little bit about some strategies to right-size it. But one key strategy that I want to just point out right now is to question our own thoughts, to realize that some of our thoughts are quite harmful for us, right? Even though so many of the human mind's thoughts are enormously helpful. And yet this whole idea that gets planted somewhere in our psyche and in our mind that we're an imposter is such a destructive thought. I think there's very little good that comes from it ultimately. So if there's nothing else that your listeners take home, I want to emphasize that point, that we don't have to believe each and every one of our thoughts. Many of our thoughts are purely fiction.
Elizabeth, let me ask you this, if we still have you with us there. When you feel these feelings that you are an imposter, we'll use that term, are there other times when you don't? Are there other moments when you can say, I have earned this, I have achieved this, this is due to my abilities and my brain and my accomplishments, or is it constantly with you?
It's so constantly with me that what I always attributed to just having a very strong work ethic, I'm, over the course of this conversation, reasoning that it's possible that because of those feelings, I push myself and deplete myself even further, even harder, even more, so that I can live up to this level of professional ability that everyone else sees but me.
Mm-hmm. Mm-hmm. Well, Elizabeth, I didn't mean to turn this into a therapy session for you, but I do appreciate your calling in and sharing with us and helping us to better understand this. Please keep listening, because Dr. Gazelle, I do want to ask the dangers and harm of living under this shadow. What are they?
I think they're really quite a lot, and I think we could hear that in Elizabeth, who's so brave to come on the air and share her story. You know, it's very depleting. It's exhausting walking around feeling like an imposter. And then, as Elizabeth really, aptly notes, how it can drive you then to stay up late at night, to work excessive hours, to kind of keep your family as the second fiddle, so to speak, because somehow you have to keep proving that you're something that you're afraid that you're not. Again, it leaves us feeling really small and living small and just not contributing all of our assets and talents and skills. And it's interesting because it's not just in the professional arena. Often you'll hear parents, mothers, for example, saying, I feel like I'm a phony mother. Other mothers know what they're doing, know how to discipline their kids. And I'm sure fathers can feel that as well. So that really takes us out of the moments that we're in, really takes us out of being mindful and living and appreciating the good that's here, because, again, the negativity bias can pull the mind so adroitly into this sense of inadequacy. I think the cost of it is phenomenal.
And I know we will get to some of the positive sides of this, of how to help yourself with it and what to do and all of that. And we'll do that after the break. But before we get there, I do want to ask about, do we notice trends among either male or female, or do we see differences depending on race or age or disadvantaged groups? Is there some pattern here?
It's widely seen that the imposter phenomenon is considerably more common in women than men. That doesn't mean that it's absent in men, but it's much more common in women. Let's face it, from a young age, women are judged by their appearance. They're taught to get along, in some ways not to create waves, not to create conflict, to kind of act small. They're also seen as being perhaps overly emotional. And then to top it off, they may have fewer role models of success and people moving up the leadership ladder. So I think in some ways we can understand why this affects women more. We're not really looking at the authentic person. We're looking at the packaging, the appearance. Similarly, I don't think there's any question that the imposter phenomenon afflicts underrepresented minorities more than others. We have so many stereotypes, so tragically, and if you're stereotyped as somehow being lesser than, let's say academically, as a young person, which very tragically can often happen in terms of sort of racial profiling in education, then if you succeed and you're, really good in academia and elsewhere, you can really doubt yourself because it's not fitting into what people told you were capable of. So I think there are all these ways that people get pigeonholed, so to speak, and get kind of put into a mindset that somehow they're not as good, deserving, accomplished, et cetera, as others. And the good news, as we'll get to, is that we don't have to really believe all of this type of thinking, all of this type of patterning.
We're going to get there in just a couple seconds. We're going to take a quick break. When we come back, we're going to talk about what are some of the things we can do to right this ship. Also, we'll explore a little bit about it's not just in your professional world, as the doctor was mentioning a moment ago. It affects youth. It affects relationships, interpersonal relationships, even those romantic relationships. It can have a devastating effect across your life, but there are ways to fix it. We're talking with Dr. Gail Gazelle of Harvard Medical School. Our phone lines are open at 888-486-9677. That's 888-4-TOWN SQUARE. And a quick reminder, Town Square is available as a podcast. Subscribe wherever you get your podcasts. And remember to follow us on Instagram and Twitter. Just look for @TownSquareTalk. I'm Ernie Manous. We'll be right back. Now back to our conversation on imposter syndrome and even burnout with Dr. Gail Gazelle, Assistant Professor of Medicine at Harvard Medical School. Our phone lines are open at 888-486-9677. That's 888-4-TOWN SQUARE. Let's start off back on the phones with Andre. Andre, what's on your mind today?
Hey, how you doing, Ernie?
Doing okay. What are you thinking about?
So, I'm an artist. A dance artist. I do choreography and creative direction, stuff like that. And this is not a uncommon conversation amongst artists in whatever field because, we work with singers, we work with musicians, painters, and whatever. And we constantly have this looming feeling of being imposters, especially if, we create something that we might not, feel like what's the best, but people love it, or, we excel in a certain area, but we're always self-examining and is this really that good? Did I really do the best I could with this product or whatever it is, especially when it's made for consumption, human consumption.
Andre,
So
thank you for those thoughts. I want to get to Dr. Gazelle on this because I think it's really an important point at how often this must be present in the world of creatives.
Really important point. Thank you, Andre, for sharing that with us. It's so interesting, all of this creativity that you have and that so many artists have and bring to the world around us. And yet, in a sense, there isn't really a benchmark. This is good, this is great, this isn't good. And I can appreciate what you're saying, that it can take the mind to a place of self-doubt. Is this good enough? Am I creating something worthy and important? And it really, I think, sheds light on this phenomenon and how pervasive it is and how a little kernel, almost like a little seed can get into our mind and then can start growing and blossoming and become bigger and bigger and bigger. And what I want to encourage you to do is to think about am I doing my best? Am I really showing up with all of my wonderful creative potential and bringing it forth in the world, because I believe I have something important inside of me? So to really recognize your strengths as a highly creative individual and to work again with your mind. When your mind gets into that little kind of niggling thing, no, not good enough, other people are better, just to see if you can quiet that a little bit, if you can let those thoughts go by, almost like the clouds in the sky, and not hold on to them as tightly. That's a thought that I have as something that might be helpful.
To go back a little bit, I would think that this is more common in creatives because there is less of a concrete structure on how we evaluate. And therefore, it may be easier to assume people may not appreciate or understand, or maybe what I'm doing doesn't have value or is any good. I would think that's harder to put a value on when how we evaluate it is so subjective.
Certainly. And at the same time, I think what your listeners can hear is that people in every profession and every calling can be afflicted with this sense of being an imposter. So what it really gets at is the shared humanity of this condition, that maybe this is just part and parcel of being a human being. Whether you're the top of your game as an elite athlete, whether you're an artist, whether you're a physician, which is really where I see a lot of people suffering from imposterism, whether you're the head of state, we can all be afflicted with this sort of uncomfortable sense that we're somehow not measuring up. And once we realize that as well, that can help us externalize it a little bit and step out of, well, what about me? I'm the one who's an imposter here, and maybe even help us laugh a little bit and think to ourselves, gosh, everybody's walking around feeling this at times, so maybe I don't have to take it quite as seriously as I might have otherwise.
We're going to go back to the phones on that note. 888-486-9677. Victor, you are up. What's on your mind today?
Hey, Ernie. I've heard this term for several years now. I'm a self-made entrepreneur who was hacked out of a multi-million-dollar business, and it took me about 3 years to get over it and start trying to make things happen again. But as I'm trying to make things happen again, it seems like I can't make anything happen. And I often see these people who are so-called experts, and I know they don't really know what the hell they're talking about. So I don't know if I'm on the imposter side or on the opposite side. But I'm wondering if I feel like I'm an imposter because I'm not getting it done.
Victor, let's find out what Dr. Gazelle thinks. Doctor.
Well, Victor, I'm sorry to hear that you've had to walk this journey. And I think your comment, again, illustrates that anybody can feel like an imposter. Anybody can really get into this thought process that others somehow know what they're doing, that they have it's almost like they've read the playbook and we haven't. And yet, I think the more people that you talk to in all walks of life, you begin to see that none of us really have the playbook. We may be successful in one area or another materially in ways that society kind of deems successful, again, in quotes, and yet we can still be struggling with this sense of, am I the real deal? So again, the fact that we all experience it, I think can help lighten it for us if we really step out of what's going on for me, and I'm not the real deal, I'm a fraud, I'm going to be found out, it can actually help us embrace the shared humanity that this is simply part of the human condition, something that all of us can be affected by.
At some point in prepping for this, I read that it's not related to depression, anxiety, or self-esteem. So if imposter phenomenon or syndrome is not related to that, self-esteem, anxiety, depression, what is it?
Well, it's a really good question, Ernie. It's not a mental health disorder. It's never been in the DSM, guidance, the DSM-5, the current diagnostic and statistical manual of psychiatric practice. So that's the good news. It's not a mental health disorder. And I think identifying it as a phenomenon just helps us understand that it's really just this thought that we can struggle with, this highly unhelpful thought that because of the evolutionary determined negativity bias, the mind can get pulled into this pattern of questioning and self-doubt. Along with the negativity bias, many of us suffer from an inner critic, right? The inner critic that's kind of like the harpy sitting on our shoulder telling us that we're inadequate in this way and we didn't do this right enough and, our nose is too big and our this is going wrong. And we can think about imposter beliefs as really kind of a twisted sister, in a sense, of that inner critic. It's that same pattern of inner negativity, harsh self-judgment that we can go along with, and we can go down that pathway, or we can stop and question, is this really true? Is this the truth of my experience? Or again, is it just a little kernel of thought that unfortunately is getting a little bit too much airtime in my mind?
Well, let's hope we're not giving it too much airtime. Let's go back to the phones and talk to Billa. Billa, what are you feeling today?
Hi, I have lived in this country now, you can tell the British accent, for 32 years, and we lived half of that time in Alaska, and I'm an artist, and I thought, I'll never have a show. I had 5 successful shows up there, and I still can't believe it. But one thing that has helped me is this little thing that I'd like to read to you. It's very short. It's from W.H. Murray, the Scottish Himalayan expedition. It's called Commitment. Until one is committed, there is hesitancy, the chance to draw back, always ineffectiveness. Concerning all acts of initiative and creation, there is one elementary truth, the ignorance of which kills countless ideas and splendid plans. That the moment one definitely commits oneself, then providence moves too. All sorts of things occur to help one that would never otherwise have occurred. A whole stream of events issues from the discussion, raising in one's favour all manner of unforeseen incidents and meetings and material assistance, which no man could have dreamt would have come his way. I have learned a deep respect for one of Goethe's couplets. Whatever you can do or dream you can do, begin it. Boldness has genius, power, and magic in it.
Well, thank you for sharing that, Billa, with us. Very impressive. Dr. Gazelle.
Yes, well, this commitment to believing in oneself, that's what I hear loud and clear, this commitment to a sense of I can do this as opposed to I can't. And that is typified in the difference between a fixed and a growth mindset, isn't it? In a fixed mindset, I am this, I can't be more than that. I'm an imposter, I'm not the real deal. And yet, we can move from a fixed mindset to a growth mindset where we have a sense of efficacy. We have a belief in ourselves. We love to learn. We're challenged by new situations. We see failure as an opportunity to learn and grow. And, I cover this in the book that I had that came out about a year ago, Everyday Resilience, a practical guide to build inner strength and weather life's challenges. Because what I also hear in what you read, Bella, is resilience, this ability to move forward despite the difficulties that come our way that are, again, part and parcel of the human experience. None of us get through this journey of life without difficulty and stress of one kind or another.
Let's try and get a couple more calls in before we run out of time. Morgan, you're up next. What's on your mind?
Hi, Ernie.
Hello.
My name is Morgan. So I just turned 18. I'm graduating high school.
Congratulations.
Thank you. And I recently just got a full ride scholarship based on being qualified and due to me being an African American woman. And I always feel like there's a running theme within my life that I'm able to get these things because of my race. And it really makes me feel that I don't deserve a lot of things. So what can you say for that?
That's a great point. Dr. Gazelle, show her the way.
Morgan, thank you so much for calling and sharing this with us. And congratulations on getting a full ride. That is just really wonderful. And I think what you're pointing to here, being a person of color, is that you're almost placed at risk for feeling like an imposter. This idea that other people may have, oh, she only got it because. And that is so unfortunate to have that put on you and put on other individuals from underrepresented minorities. It's really undeserving. You know, you're being judged, I'm sure, on your merits. It's your merits that got you a full ride, all the effort that you've put in. And so it's very unfortunate, I think, that because of skin color or because of gender or because of a variety of things that aren't really the part of the truth of who you are, you're actually left with a little bit of a stigma. So I want to encourage you to embrace the fact that you got this full ride. You know, you've obviously put a lot of time and effort, and you have a lot of skills and strengths that are being acknowledged, by this kind of scholarship. It's just wonderful.
And Morgan, this may come across sounding wrong and not the way I mean it, but I want you to hear the spirit of it. I'm sure there were other young black females who applied for the exact same thing. You were chosen. There was something you did, you showed, that made you the one that got this full ride. And for that, you should be very proud. Morgan, thank you so much for calling. I also like the fact that you're 18 years old and you listen to this show. So I think that's another reason that shows how smart you are.
Thank you. Y'all have a good day.
Thank you, Morgan.
You too.
Let's go back to the phones quickly and let's see if Vicky, are you there?
Hi. Yes.
Share with us.
I am just really in awe that I'm hearing this show and hearing Dr. Gazelle, because there is such a pervasive thing about achievement and being genuine and who you are in the world. And we're struggling so much with so many outer things in the world that reflect our insecurities inside. And a lot of it is unconscious. I want to say there's a lot below the surface when you have all those thoughts bubble up. And fortunately, you can look below the surface when you start to look at those thoughts and look at what's going on. And there is a lot of support out there not to label yourself as depressed or deficient or unworthy. That little voice inside your head is, and that little self-doubt is in all of us. And there's a lot of unconscious stuff feeding it. It's not just you and alone with your thoughts. And by, checking them out and calling them and embracing them and saying, well, thank you for showing up. So now I know what to do with it. And I know that that's not necessarily true. And finding a way to do that and not being labeled. The mental health profession is coming a long way from where it used to be. I was in mental health profession for over 40 years. So I'm so glad that this book came out and that you're inviting her and embracing her to come and explore this topic. It's so important to talk about it, especially
Vicky,
now. I really appreciate it.
Thank you very much for calling and sharing. Doctor, before we run out of time, we've danced around this a little bit, but there are things folks can do if they feel that they fall into this, if they start to feel themselves experiencing the imposter phenomenon. Give them some guidelines, some ways to help them see through it.
Definitely. Well, first and foremost is to recognize that these imposter beliefs and moments are simply thoughts. That's really all they are. They're thoughts that occur in the closed space that operates between our two ears, and they need to be taken out in the light of day where we can consider them and we can question, is this thought true? So that's where mindfulness, really applied mindfulness, comes in, getting to know your thoughts and really beginning to become the observer of your thoughts as opposed to being the captive one who is completely engaged with them. So that's the first strategy. The second is to develop compassion for ourselves, that muscle of self-compassion that is really atrophied in many of us and can remind us that there is a shared humanity, as we've talked about, that other people experience this and can help us be kinder and gentler and more patient with ourselves. Those are two, Ernie.
Well, Dr. Gazelle, thank you such. I'm sorry we ran out of time, but I'm happy we ran out of time because that meant folks were engaging with us. So, Dr. Gazelle, thank you so much for joining us today.
Thank you for having me.
Dr. Gail Gazelle is an assistant professor of medicine at Harvard Medical School and a master certified coach for physicians and physician leaders.